So, hi everybody. Welcome to our session on making CPAP comfortable. So, I'm joined by some really special guests today. So, we're going to get into them in a little while. But while you're joining us, go ahead and add where you're joining from. So if you are joining here in the States, put the state that you're joining from. And if you're outside the United States, go ahead and share the country that you're joining. We love to see in the chat who's tuning in, and you definitely can ask any questions as we go along. And we also love it when people share their own experiences in the chat. So just feel free. We have my colleague Ali is monitoring that, so we'll get your questions in real time here. Um, so thanks for joining everybody that's tuning in live and also watching the replay. So the first, so we might want to just all say a really quick hello. I'm going to do full bios in a minute, but do you want to just say hello and your name and where you are?
Hi, I'm Kath Hope, and unfortunately, I'm not in Florida next to Emma.
I know.
We're in Hull, which is in East Yorkshire, in the United Kingdom, in England,
And
and
who
it's
are you
cold.
with?
And it's cold.
I'm Natalie and I'm demo manager at the charity and I'll do demos today.
Beautiful. Thank you so much for joining us. And Dr. Silverman, do you want to share where you're joining from?
Sure. Hello, everyone. My name is Dr. Sarah Silverman, and I'm joining from beautiful Orlando, Florida, right outside of Disney World.
Perfect. Okay, so I'm going to go ahead and share some slides here. Um, let's see. Oh, I'm not sure if it did the thing. Can we see my screen or no? Can you see my slides or no?
We can.
You can? Okay,
Yeah, perfect.
perfect. So today we're talking all about making CPAP comfortable. So I think that sometimes we overlook that a lot of people starting CPAP therapy sometimes struggle a little bit to get used to it. So that's all what today is about. So if you're a new or struggling CPAP user, you're in the right place. Um, so there's a couple of things, some housekeeping before we get started. So I already mentioned we'd love for you to share in the chat where you're joining us from. Also like, comment, and share this video on YouTube. That just really helps more people find the content and get the help they need. Also to bear in mind, video and comments, like so this video that we're recording and also the comments that are going to stay with the video, they're all public. So don't share anything in there. It's great to share your own experience, but don't share anything in there that you don't want to be publicly available. And I already kept saying, send your questions in the chat. Everything we do here at Project Sleep is for educational purposes. So it's definitely for education today rather than medical advice. So if our discussion, makes you think, oh, I wonder if I have sleep apnea or um, things of that nature, you're going to want to take those to a medical professional. So this is definitely just for education. And the exciting part is we're building a toolkit together. So whenever we do these YouTube lives, we take everything that all of our guests were talking about and also the comments in the chat. And we build a toolkit, a PDF toolkit out of that. So this is the one from our first session on Could I Have Sleep Apnea? It's available now on our Sleep Apnea Squad website. And so this is just three of the pages. They're usually sort of 20 pages long and they just have a lot of information in them. So that can be a really helpful resource after the broadcast. Okay, so let's get on to our very special guest today. So today we're joined by Kath Hope, and Kath is the founder and CEO of the Hope to Sleep charity in the UK. She's also a patient living with severe OSA and nocturnal non-obesity hyperventilation. Kath was diagnosed with severe OSA around 18 years ago, same as me. Um, And like many, she struggled at the beginning of her CPAP therapy journey with comfort issues. She went from dreading bedtime to now never considering sleeping without her machine for a full night's sleep every night. Her passion was to help other people living with sleep apnea, which resulted in the formation of a charity that currently supports around 25,000 patients in the UK and even worldwide. So I'm so thrilled to have Kath with us. She's such an expert on this. And then next we have Dr. Sarah Silverman. She's a Stanford trained sleep psychologist and behavioral sleep medicine specialist who's passionate about helping others improve their sleep through science-backed and non-medication treatment approaches. Dr. Sarah is an expert in cognitive behavior therapy for insomnia, the first line drug-free treatment option for adults with chronic insomnia. CBTI is an effective way to improve sleep naturally and overcome chronic insomnia without medication. So she's also, the reason she's here today is she's also an expert in using CBT for positive airway pressure therapy to adapt to it. So it's an effective way to help with any difficulty relating to using CPAP and provide drug-free assistance with PAP therapy adjustment. And you can connect with Sarah's all over social media. So her social media handle is at Dr. Sarah Sleep. So you can find her all over the place. So thank you so much for joining us, Dr. Silverman.
Thank you for having me.
Okay, so these are just some, before we get stuck into our conversation all about this topic and answer some of your questions, I just pulled out some different topics that I think are going to come up, sort of themes that we're going to see again and again as we talk about this. So the first thing is just how differently people are supported with CPAP. I'm mainly talking about the United States, Kath, because I know that in the UK it's largely similar. But here in the United States, it really can vary between people having one-on-one mask fittings in home CPAP setups, and then it can range right through the gamut to people that are getting no help at all. So when I started CPAP, I was given a plastic bag with a CPAP machine and a mask that didn't fit my face, and really no support and no idea of who to call. So that could be the situation you're in, or you could really get a lot of support and have people that you can call. So just to recognize that. And then the second thing is what we're talking about today is comfort issues. So things like, we're going to talk about all of them, but like skin irritation or difficulty getting comfortable with sleeping with this mask on your face at night. So they're not really medical problems. So sometimes people have issues where they're taking these problems to their medical doctor who prescribed the CPAP, and that medical doctor isn't really perceiving these comfort related issues as being a medical problem they can help with. So we're hoping to kind of plug that gap today and give some helpful tips to help you get used to CPAP. And then as with everything we do at Project Sleep, you're not alone. So I hope that especially the people that are joining us live in the chat will really feel that sense of community, that there are a lot of people dealing with some of these issues. So that's my little intro. So now I'm going to turn to Kath. And if you could just start, Kath, by explaining a little bit about when you were first put onto CPAP. What did the support or lack thereof look like for you? Like, what were your problems and
Well,
way?
support. Support, it was actually fairly quite rare to be diagnosed here in the UK back then. Most people didn't even know. They thought that they used to say to me, and when won't you have to use that machine anymore? When will it cure you? Or they used to think it
Yeah.
was narcolepsy, and you know, we know a lot more now. We've done our own awareness, and you know, we've had big campaigns in the UK, so people at least do know what sleep apnea is now. But no, there wasn't support. I have to give credit to my hospital though. Probably because they had more time in them days without as many patients.
Yeah.
But they did help me as much as they could, because I can assure you, masks were not made you know, for the, shall we say, normal sized lady back then. You know, the headgear used to go to twice around the head, you know, to even try and get a
So you
seal.
were finding just that the mask was too big.
Yeah, and the headgear was enormous, you
Yeah.
know, it wasn't designed really. I mean, thankfully now, masks have come a long way, you know. I mean, this is a modern, what we used to use back then.
Yeah.
But they were all that style. And
Yeah.
that style do not suit everybody.
Right.
And Natalie will tell you that when people come to the charity, you know, one of the things we're looking for is the receding jaw. That kind of mask is going to cause problems on the bridge of the nose.
Yeah.
As they try to get the seal here, this is going further back and it's pressing more on the nose. But fortunately, I mean, this is my favourite. This does not mean, can you see it okay? This is the Dreamwear minimal contact mask. We would always go for that first. But not just the Dreamwear. There are other masks, you know, there are the Amara View, the F30 series, the Evora. Have I missed any out?
Yeah,
So these are
yeah, they're all minimal contact. You know, and we're talking for full face people here because there's a lot of good ones for.
So we'll definitely get onto that. So I was really interested in how you actually solved your problem back then. Like
yeah. Well, I've just gone further on in my talk. You know, I've just
that's okay.
gone way around. I'm getting carried away. So so those were all the you know, the masks that you know we had access to back then. They're obviously much better now, like I said. But my problem was by then I'd realised that my mum had had a fatal heart attack due to no treatment. So there was no way I was going to continue with these struggles, you know. I mean, most of this I've already spoken about. I'm not going to go into that today because on Emma's previous channel, Sleep Apnea Stories, a year as of yesterday, Emma, the 10th of January 2024, I told a lot more of my personal story, if anyone wants to look that up. You know, I was just determined, as much as I did, don't get me wrong, I didn't like the CPAP, but I knew I needed it. And I did not want history repeating itself. So, you know, and leave my children, you know, without their mum. So, like I said, I was lucky with my clinic, but one of my biggest struggles, because of these horrendous masks, you know, that there was back then, was nasal bridge sores, as I've already said. And in fact, that was years ago. We lost this for a while. The CPAP moisture therapy cream, which is from the UK. Can you see it? Okay.
Yeah, sure can.
Yeah. Now that was Lucille made that, and then they went out of business. So for several years, a lot of people struggle because that really is. A lot of the clinics here call it the magic cream, and I had to bring that in from the USA because the most important thing, it has healing benefits. So it's not just the moisturizer, but most importantly, it can be used safely with our breathing, and it won't damage the mask. So
you're talking about you were getting
the nasal bridge
right here.
for the nasal bridge. And then
I think was kind of, well, not funny, haha, but like I think a lot of people would either give up or they would just, you know, kind of think, oh, I wonder what can be the problem. But were you on the internet, like figuring this out?
Yeah. And I did get help. When I say there was no support, I actually joined some USA forums, and I've still got friends, American friends from those days, but there wasn't the support in the UK, not for the specific struggles with CPAP, you know.
And so did you get some of that cream sent from the United States?
Yes.
And was there other things at that point that you were getting sent?
Yeah. And I used to wake up with puffy eyes. We see pictures in our Facebook group all the time of people really struggling because obviously, you know, the mask, I had to have it tight. Now, don't start telling me, anybody in the chat, not that I can see the chat, that they inflate like a hovercraft. Because I can promise you, if that mask isn't the right one for you, and if the size isn't right, forget it. You have to tighten it.
Yeah.
If you've got the right mask and the right size, that's a different story. But you've got to bear in mind, I was trying to use masks that were not suitable for me, but I needed the therapy.
Yeah.
I've got dreadful pictures, and I'm quite an open person. But even I dare share those. Looked like I'd been in the boxing ring.
Yeah.
And I didn't answer the door in the morning.
Yeah, so I think were there other problems you were dealing with apart from having this bridge of your nose issue? Did you have issues with it not sitting?
Yeah. Well, the puffy eyes, like I say, and also the strap. You know, because I was having to tighten them, I had no choice.
Yeah.
You know, big strap marks, you know, across my face. And in actual fact, I notice your ex-president Biden also has the same problem.
I saw that picture too.
There's been quite a few, if you look closely, where he goes out with strap marks, which is not necessary. We don't have to wear our equipment during the day. Yeah, I saw someone at my own GP the other day, and I wanted to stop, but he was talking, and I wanted to say, you don't need those strap marks.
Yeah.
So the strap covers, you know, they were absolutely essential.
Could you maybe show us? I think that you had
yes, Natalie's got some,
just so people know that what you're talking about.
Yeah,
so
we
these
have all
are available really widely now online.
Oh yeah, in the USA as well. They don't need to be bought from us.
Yeah.
And this one here, this goes round the back of the neck. And we have seen some others out there, but some of them at the back, what they have, where are they? Is here they have a big bump, and that can actually cause bigger problems because you're sleeping on a lump. This is really discreet. Look, just slips round the back, and you know, you can see the reviews, they speak for themselves, you know.
Yeah, so for people with the strap marks, definitely strap
absolutely
are a great place to start.
the magic, they're absolutely magic. And also the mask liners, there was no mask liners out there, no, not even in the USA.
I even have some mask liners. I just have these flat, like, do you have some there? I feel like Natalie's doing a great job of sharing stuff.
Yeah. Gee, these
I have this one.
You've got the Ren. We've got the Silent Night. We used to do the Rens.
Yeah.
But we've moved on to the Silent Night because the Silent Night ones stick to the mask as well. Natalie will show you. Yeah, if you show.
So this is particularly, I think also with, so partly for stopping small leaks, like I think that can really help.
Yeah, and comfort also, as well.
Yeah, like skin irritation. I think, like if there's anybody,
you'll see on my Dreamwear, I have one on my Dreamwear. Look. Yeah.
Yes.
And if you just show the back, Natalie, you must put them on right there. They must be put on right. But I used to make them. I would like to make it for the Dreamwear, man, Joe. You know, but they were all traditional, so even I could make them. And you know, if I can do it, anyone can do it. But that is an option when people can't afford liners. Remember that, you know. But just one little warning I'll give is, be careful what you use. You'll notice I only ever used white t-shirt material. Why did I do that? Because if you start getting colours and you slather, the colour might not be fast, you know. And then also, I've even seen people selling them, you know, on places like, what's that site you like? Etsy. And they're actually fleece. You don't want fleece. We use fleece for comfort here, but don't put fleece near your mouth. because you're going to breathe in. I mean, all this about microplastics and dust and fibers, be careful what you use, where
Yeah.
you breathe in.
That's really good advice. Okay, I'm gonna
Yeah.
pause you, Kath, because I'm gonna
Yeah.
pop over to Dr. Silverman now.
Yeah.
Um,
Good.
and a reminder for everybody joining us in the chat, let us know where you're joining us from, and also if you have any questions, go ahead and pop them in the chat, and we'll get to those when we can. So Dr. Silverman. A lot of people haven't really heard about cognitive behavior therapy and how that might be used to help people adapt to CPAP therapy. So I wonder if you could just really give us an overview of what CBT is and just why that might be helpful for people. Like some of the things I hear people talk about are claustrophobia, and also I feel like so many people deal with taking their mask on and off at night and just not getting used to it. So I'd love to hear your input on that.
Yeah, for all the reasons that you just shared, there's so many potential factors really impacting the ability to even use CPAP. So, a common theme that I've been hearing you all share is when you get diagnosed and then you're told that you have to wear CPAP, there is oftentimes a lack of support, and sometimes there's even no support. So, using more of a CBT or cognitive behavior therapy approach can really help provide that support that I think is so needed when you are told that you need to use CPAP. So in a nutshell, I help my patients really troubleshoot their CPAP use just to make the adjustment process a little bit easier using CBT. So cognitive behavior therapy, in a nutshell, the cognitive part really explores any negative thoughts or beliefs around using the CPAP. And the behavioral part really explores any behaviors or habits that actually might be getting in the way of using CPAP, or I think for a lot of folks, sometimes even having the motivation to use CPAP. So I'd say the two most common reasons that folks will get referred to me is either they're newly diagnosed with sleep apnea and they're trying to use their new machine, or maybe they have had their machine for a little while and they're really struggling to use it. So maybe it's been a few months down the line and they're still dealing with some difficulty adjusting to using CPAP. So by using CBT, we can really explore any, again, negative thoughts, beliefs, behaviors, habits that actually might be getting in the way of really making the adjustment to CPAP a little bit easier for folks.
Thank you for explaining that, because I think oftentimes people have either never heard of CBT or they think it's only for insomnia. And we should also just mention, did you want to share a little bit about how sleep apnea can run alongside insomnia? I think people sometimes don't realize that those two conditions can occur together.
Yes, absolutely. So this is actually really common, and it's what's referred to as COMISA, so which stands for comorbid insomnia and sleep apnea. And this is also another big reason that folks might get referred to someone like me, a sleep psychologist or behavioral sleep medicine specialist. And so typically when someone is dealing with both insomnia symptoms and also having difficulty adjusting to CPAP, it's very much this combination approach where we really target the insomnia, but in doing so, we can actually reduce CPAP, reduce apnea severity and actually make CPAP a little bit easier to get used to. So it actually is really effective when we combine CBT for insomnia and also use CBT to help the adjustment process to CPAP. A lot of folks actually see significant improvement in both their insomnia and also their AHI, so their sleep apnea severity.
That's great. I have to remember to unmute myself. Okay, so that was super helpful. Thank you so much for sharing that. So we're going to go back to Kath, and I think that one of the things I thought would be really helpful would be just to have you explain a little bit. I know that you have people come in um, oh, we have a question. Oh. So we did have a question for you, Dr. Silverman. So they're asking, what would some examples of cognitive behavior therapy be? So like, I think people maybe don't understand, like they're gonna come and see somebody like you, but what kind of like, are they doing talk therapy? Like, do you have specific exercises you do? How does it work?
Yeah, such a great question. And it is personalized to each individual. So it really does depend on what is going on, whether it's something related to actual mask fit issues, whether it's claustrophobia, worry, anxiety around using the CPAP. So the treatment is very personalized depending on what the individual is dealing with, what the primary concern is. But just to give you some examples, and it's really hard to explain it in such a short period of time, but essentially, as an example, what I typically start off with, especially if someone is really struggling with actually wearing their headgear and their mask, is to start off with what's called a CPAP gradual exposure hierarchy, which is pulled from what's called exposure therapy. And it's a step-by-step way of really starting to get desensitized or used to wearing your mask or headgear. And so in doing so, something that might be recommended would be, for example, to pair putting on your CPAP mask or headgear with practicing a deep breathing exercise. So oftentimes there is quite a bit of relaxation training that is recommended in combination with getting used to CPAP. So where a lot of people might initially come in and say, sometimes even looking at their CPAP can start to increase worry or anxiety about having to wear their machine. We want to pair the actual physical act of putting on the mask and headgear as a cue or in combination with actually practicing a deep breathing technique. So the mask becomes this cue or stimulus for relaxation rather than worry or stress. So that would be one example. And of course, there's hundreds of ways to practice deep breathing exercises. So I always say starting off really simple and with a breathing exercise that feels comfortable. But that would be something where we'd start off really simple with relaxation breathing techniques as a way to just get comfortable with using CPAP and using your headgear. And sometimes even before you even take it to bed, sometimes we even start during the day or in the evening. I often recommend wearing the mask or headgear while watching TV before bed, just to get really comfy with it. And that can also be a time to incorporate some deep breathing as well. So very much this gradual step-by-step process to get there, but it very much can incorporate quite a bit of relaxation and breathing exercises.
That's great. Thank you so much. And so we're going to go back to Kath because I want to ask about, I know that at Hope to Sleep, you are helping, I think you're actually physically helping people with mask fittings. So I think like we talked a little bit about when you know the mask doesn't fit well, but I thought maybe we could talk a bit more about like leaks. How would somebody know that they have a leak in their mask, and how do they know that the mask is fitting well? Like, what do you look for in a well-fitting mask?
This is me, is it? Yes. Well, obviously, the some leaks are obvious. It's like blowing up that balloon, like I probably already said, and letting go of it. And honestly, mine were horrendous. I was mortified. I was sure the neighbours on our bedroom wall thought I had a severe problem with flatulence.
Because of the noise that the mask was
The
making?
noise, yeah,
Yeah.
it was horrendous. And this is why another reason why I started to make these liners. But some people are actually, now we've got apps, obviously, we didn't have that then, and access to some of the software. And sometimes people are so surprised because they say, I didn't even realise it was leaking.
Yeah.
Because sometimes you just get that subtle, leakage. The other thing is, if you start putting certain things like thick, we see socks, some people are using thick socks. Well, that's going to muffle the sound. What is it? Have you seen them? They make a liner out of a sock or something. But the fluffy socks, like I said, there's always the warning about inhaling the fibres. but along with that, it can muffle the sound of the leaks. And then they wonder why they're still struggling, but it's not their fault because they're doing it, making every possible effort that they can. So, you know, some of them are obvious, others not so obvious. But we're talking about, you know, things like liners, but you do have to remember, you know, we do hear of clinics say, oh, right, yeah, here you are, Emma, there's a large, off you go. It may not fit you, you know, and this is like why, going back to the mask fittings, this is why people travel from the other side of our country, and I kid you not, they've even arrived on planes. Well, not Hull on planes because we don't have an airport, but you know, to the UK on planes. That is no word of a lie, is it? Because people are absolutely desperate. You know, I mean, Natalie would probably like to explain that, because although I did train Natalie originally, I would say Natalie's even better than me now because she's not at all clumsy like I am. So do you want to have a word about that?
Yeah, so I do the majority of the mask fits at the charity, and the best thing about it is we have a bed. So we actually have 2 beds now. We've upgraded. We've got 2 beds. So we've got 2 mask fitting rooms. Obviously, when we go to hospitals, we get ourselves fitted with masks. We're sat up a lot of the time. Clinics, funnily enough, even though they're in wards, do not have access to beds, so they can't try the masks on. They can't be desensitised to masks as well, because it's not just mask fittings. We also run desensitisation. So I'll have a patient in there for hours, making sure they're comfortable and they're happy, so when they go home they're comfy. And the other thing that we do as well, if clinics say do have a bed, and they do, a lot of the time they miss this out, is your pillow. Your pillow is so important with a mask fit. Firm pillows, we try and say avoid firm or a memory foam pillow. So we need that medium balance. We also try and avoid CPAP pillows as well if we can. We just don't find them helpful, and we actually don't sell them. We don't believe.
Actually, before you joined us, we did have a try, and there wasn't enough people who found them helpful. That was something I did bring in from the USA.
So just to let people know who are joining us live or watching the replay. So what we're talking about with CPAP pillows is, I wish I had one. I used to have, I had one, but like they have like almost like a cutout so that when you lie on your side. But the problem that I've heard from a lot of people and that I had myself is oftentimes like you move in your sleep, right? So if you were just lying still, it would probably work. But I usually don't recommend people spend a lot of money on pillows. Like
we don't either. No, we
so
totally
sorry, I
agree.
interrupted.
No, we totally agree with you. You know, I mean, I'm not saying that way. I mean, they're out there, and there are a lot of people who do like them. When we did have a go at selling them, this was many years ago, and we did get the best one at the time from the USA. The reviews were so low. And we don't like selling expensive things, you know, unless they're going to work, you know, for more than such a small percentage.
So now we have a bunch of questions coming in on the chat.
Oh,
So
right.
I wonder, like, had you finished what you were saying? I really appreciate you sharing, Natalie, all about how you guys do that. But I think that that's so important, having people actually lie down in a bed in their normal sleeping position, because even if people are getting fitted here, it's usually sitting up in an office, and lying down on a bed is really important because that's how you're going to sleep.
Well, I mean, and it's not uncommon, Emma, that about what you were saying the other week. We had 2 people with 2 beds. I was doing one fitting upstairs. Natalie was doing another fitting downstairs. Natalie had loads of time on her hand though, because he fell asleep for 3 hours. Collecting, you know, months. You know, it just needed a bit of comfort. That's all.
Okay, so here are some questions. So the first one, which I think is such a common question from Lynn, is what about those of us who just really hate the whole CPAP experience? Like what, you must come across these people a lot. Like what kind of words of encouragement do you give people?
Well, firstly, to remember, even just, well, you talked about 25,000 people, which most of those are on CPAP. There's more than 12,000 people in our Facebook support group. None of us would choose to use CPAP. Always remember that. Sometimes when you're struggling in the night, remember someone else will be struggling. You know, we all know. So we don't choose CPAP, but CPAP is the gold standard treatment, and we can't get away from that. Me personally, you know, despite all my problems years ago, you know, I cannot believe I'm even on this webinar, you know, trying to persuade people to use it because it works. Now, yes, there are other things out there. There's Vic Vere on his channel, Professor Vere, he's spoken about 3 different implants. By all means, look into that. But while you're doing that, please use your CPAP because we know it works. Come support. If you know, like I say, nobody likes it. Join others. We're all in the same boat. You know, we all empathise. You know, in our group, you know, have a rant. You're with the right people. We can rant with you, you know, but we can support you as well. Just try your best to use the CPAP, knowing it is the gold standard. Always aware that in the future something else might work for you. But the problem we're at is that it's not always one thing that'll work for you, because a lot of the you know, we do sleep studies on people who are using, say, mandibular devices, and it, you know, it's, I mean, some will just treat perfect, but there are a lot where it partly treats. Well, you, Emma, you use a mandibular device as well as CPAP. Why do you do that? You know?
So I really appreciate that question, just because there a lot of people have the same sentiment. I would just say that, so the last session we did as part of the sleep apnea squad series, we covered all of the different treatment options for sleep apnea in an hour. And so we're working right now on the toolkit for that, which people will be able to print out. And so I think that exactly what Kath just said, what I never want to happen is for people to struggle with CPAP and abandon it and not go back to their doctor, right? You know, like, try all the different, you know, things that we're talking about today, but if that doesn't work for you, that's okay. But what I really don't want is for people not to treat their sleep apnea. So there
No.
are resources, and we'll make sure that there's links to our past session below this video for people.
Yeah.
So
But support, I think, support and looking at the advice. In fact, Farah has got a link to share, because we can't cover everything today, which is under the help and tips on our Hope to Sleep website. And you know, it's just a page with practically every problem we can come up with. So, but really try and join groups. You know, there's plenty in America, and we've got ours in the UK. Join groups, join other people, you know, toss around ideas, because we all help each other, and we learn as well. We learn every day. We learn something new.
So we have another question, which was definitely on my list as a really common problem people have. And it says, it's from CC, and it says, sometimes my mouth gets so incredibly dry. Um, you know, she's saying, is that because it's leaking? But what are the reasons for the dry mouth, and how can people address it?
Dry mouth. We go on and on. We've actually got on our own YouTube channel, as part of, anyway, it'll say it in the description, but we've actually done it, you know, webinar ourselves on this, because it is so important. You must not tolerate dry mouth, because it will cause gum disease, tooth decay. A lot of the people, when they're complaining about the teeth, just assume it's because the mask is pressing on them. It isn't. Well, it may be as well, if you're having to do what I used to do. But the biggest problem is the dry mouth, and I don't think we've got to hand. But if you have a look on our website, but you can get them in the USA, and they're called Xyli melts. That's XYLI I
Melts.
melts. Zally melts. I can't believe we haven't got a packet here. And it's a little disc that you just pop on your gum. They are amazing. We have people not just purchasing them for our condition. We have people who've had to go through cancer treatment, and the treatment, is a dry mouth. We have people with Sjogren's disease, but obviously, before going to even Zally melts, remember CPAP humidifiers. I don't know how it works in the USA, because obviously your insurance pays for things, but a lot of the time people are giving CPAP and not even told there's such a thing as a humidifier that attaches to the CPAP machine. Always try that first. I honestly believe everybody should have a humidifier, even if they don't use it all the time. Certain seasons, you might get a drier mouth. When you've got a cold, you need more lubrication. In fact, when you've got a cold, it's handy to have a full face mask as well, because it's hard to breathe through your nose.
So
But
we
yeah,
just had another question,
yeah.
which leads straight into that, which is somebody said, can you use CPAP when you have a cold? And
Ah,
yeah.
yeah.
So this is
You
one that I have dealt with a lot myself. And yeah, so just to echo what Kath just said, when I was pretty new to CPAP, I didn't realize humidifiers were a thing. And I, similarly to you, this was back in 2008. So I was looking on some of these like old-fashioned forums to try and get answers. And yeah, during that there was a lot of people were talking about humidifiers, and I had to buy a separate humidifier to fit onto my machine. So that is a really good thing to mention. The other thing about dry mouth as well, is oftentimes people, if you need a full face mask, I use a full face mask because my nose doesn't work very
Me
well.
too. Yeah.
But if people, I just thought I would show this really quick. Just this is like nasal pillows that fit, like under your nose. So if you can breathe well through your nose, then doing something like this, oftentimes people are recommended by their doctor to use like a chin strap, which keeps your mouth closed, and then it definitely doesn't get dry. But it just depends like what kind of mask you're using and how it all works for you. But so yeah, going back to colds can be really, really difficult to deal with all the nasal
Yeah.
obstruction.
We encourage it though. We absolutely encourage it, because anybody who has a cold, even people without a diagnosis of sleep apnea, will actually probably have a lot of apneas, even though they don't normally have sleep apnea. And ours gets worse, because it's so difficult to breathe properly. So if possible, and again, on our website, if you do a search, sleeping with CPAP with a cold or something like that, it's so important. There's so much you can do. If you have a backup full face mask, even though you might use a mask like you've just shown, Emma, it will help you, because even the best nose breather in the world will get congested with a cold. That can help. Also, we must never put anything in our humidifier at all. But you can just get, Vicks we have here. Albasoil, I'm sure you have those in the States, do you? Albasoil and Vicks.
Yep.
If you just put a little pea, don't put it up your nose. If you look at Vicks, it actually warns you, do not insert Vicks in the nose. But if you put it on a little tissue near your air inlet, and then the aroma will come through the machine without harming the machine and without it being too intoxicating for yourself, and that will help you as well. So there are, there is a whole article about that on the site.
That's great. We're going to be sharing all about your resources. We're putting together resources like for our thing, so we'll be able to share those direct links as well.
Yeah, because that one's an
So
important one.
okay, so really quick, let's see. So from Martin was asking, last week I developed I can't pronounce this word, spondylosis.
Oh yeah.
Top of the spine. My mask is causing unbelievable pain. At the moment, the advice I got was don't use the CPAP. But do you
No
have
way, Martin, don't listen. Don't listen, Martin. You probably also are on medication, strong medication, if you're in a lot of pain like that. Depends on your medication. Read the leaflet. It will probably say, you know, of the health risks with sleep apnea. So please try. If you're in our group, start a post on that. You know, in the Facebook group, Martin. If not, feel free to join us. Lots of people will help you about that. Please, you must wear your CPAP machine, and especially if you're on medication.
and also talk to your doctor for sure and like keep going back. Like if that's what they're telling you, there's got to be
I would
other.
imagine it's a GP saying that though, rather than the sleep clinic.
So the next one I'm an absolute expert in, which is from Nadine, is saying, how do you cope with bloat from swallowed air? So there's something called aerophagia, where some people deal with instead of the air going into their lungs, like it goes into their stomach and gets trapped. So there's a couple of different things. Like I would say again, like people tend to deal with that less if they're not breathing through their mouth, right? So if you can do a nasal pillows or a nasal mask because your nose works well enough, then that can sometimes help, and keeping your mouth closed helps with it. But for me, that wasn't an option. So there's a couple of things. I usually uh, have found, like certainly in terms of like dealing with the discomfort when you wake up. There's some pretty simple, so I think it's the University of Michigan has a thing on their website that we'll link to, where it kind of shows a really simple way to massage. You can do self-massage the correct way around your intestines, and that will get rid of most of that air so that you don't have the flatulence during the day come up like at times that you don't expect it. And so also along the same lines, bicycling your legs can help relieve the wind before it becomes a problem. So those
Yeah,
are
what if you don't mind me saying, I had a really bad problem with that at the beginning, which was caused through these bad masks and mask leaks. I was gulping air, and I used to wake up in the morning, and some days for 2 hours I couldn't even walk properly because the pain was so bad. I didn't know in them days it was called aerophagia. And it very rarely happens now. One thing I will say is that it is quite common when you first start CPAP. Another thing, what you were saying, Emma, is, you know, about nasal mask. Yes, if you can breathe through your nose, that'll help. But remember, there are some people who are given nasal masks who actually aren't okay, and they will swallow air if it's the wrong kind of mask for them, because you know they can't breathe through the nose all night. So there's a few reasons. I think for me, my reasons were badly fitting masks, you know. And like I say, it rarely happens now, but there is a good, we've shared it for years, Lanky Lefty, I'm sure a lot of you know. He's got a couple of videos about aerophagia. You know, and curl, apparently, is it curl? I've said the right thing, curl. Do people have curl? Someone else said
Charcoal.
charcoal. Apparently that can help. I've never had it myself, that's why. No,
and
don't go and eat black coal.
so as I knew would happen, like we're kind of running out of time, but
Oh,
I wanted to go back to Dr. Silverman, but first, we had a question from Rachel. Is CBT support available in the UK?
yes.
It is.
Yes, the CBTI, now you've caught me off the hop because I can't remember them all now, but the Sleepier, what's the other one called? Sleepio is available on the NHS. And what's that other one I shared that's completely free? I'll give you some links later. I'll go to the comments. I'll go to the comments later and give you 3 links. One of the things, Sarah might, come across as well, is that sometimes if people have, they're struggling with insomnia, but they haven't got a diagnosis of sleep apnea. So often, I'm sure you found, Sarah, that they, that's often the root cause of the insomnia, but you don't know that at the time. And I'm sure you're, very aware of that and question people in case they do have it, because it's very hard, isn't it, to deal with insomnia when there is an underlying problem that people don't know about.
For sure. So Dr. Silverman, I guess, is that something that you come across? People who come because they have fragmented sleep and insomnia, and then they actually end up with a sleep apnea diagnosis. And then the other thing for you before we wrap up, it's just kind of like to normalize for people, that this is a challenge for a lot of people, and also to kind of ask, like, do you see patients that no matter what you go through, they just can't adapt and they end up doing a different treatment option? Because I think that's one of the things that people tend to feel a lot of shame if they can't make this work for them, right? And we hope that they can, but if not, I don't want people to leave feeling shame about it.
Yeah, there's so much shame around using CPAP or not being able to use it. And yeah, it's incredibly common. And unfortunately, I don't think it gets talked about enough how difficult of an adjustment it can be. And so I always encourage folks to really have a upfront conversation with their doctors, their sleep specialists, about what options they have. Because sometimes folks are told, here's your CPAP, and there really isn't a conversation about what other options are available. And so it does become this thing that they have to use. And if they don't use it, then sometimes they're even, for lack of better words, kind of threatened that their machine will be taken away if they don't use it for a certain number of hours. And so that puts a lot of pressure on you to have to use it within a very short period of time, when that adjustment process can take a while. And I know everybody's different, but for most of the folks that I work with, I'd say on average, the adjustment process is anywhere from 3 to 6 months, sometimes a year, sometimes more, depending on the individual. So it isn't something that most people will get and be able to put on and, say, oh, I'm good to go. I mean, of course, there's a few folks where that's the case, but I'd say the majority of folks, that isn't the case. And they really do struggle with getting comfortable with it and really incorporating it into their nightly routine. So I think it's really important to just normalize how long the adjustment process can take, and know that there are folks out there who do want to support you along that journey. Although I know it can be hard to find the support, but these days there are so many amazing folks who are all about this, like you all in the UK, Kathy. And, this is just such an area where I feel like now more than ever, people do have more support options. So I think it's important to have a conversation with your doctor. And if you're not really getting that conversation about other options, perhaps finding another specialist, because you deserve to know what other options are out there for you in your specific case. I think that's really important, to advocate for other options if CPAP really isn't working well for you. So that, I think, is such an important conversation to have. And to answer your other question about folks who might come in with insomnia, it's actually very common to have, what might look like sleep maintenance insomnia. So really having that sleep fragmentation and waking up multiple times during the night, having difficulty falling back asleep, could very well, look and present like sleep maintenance insomnia, but could very well be undiagnosed sleep apnea. And I see this to be the case a lot in women, especially because a lot of doctors, if they don't fit that classic stereotype, if you will, gets completely overlooked and undiagnosed. So it's incredibly common. And it's certainly something where I'm often encouraging the folks I work with to go back to their doctor and say, look, it's worth getting a sleep study, looking into this further because they're really struggling during the day. And I think that's the most important thing is getting people to a point where they know that they have options and can actually feel their best during the day.
Yeah, we find as well, there are a lot of people with insomnia, and when they do treat the sleep apnea, it does stop the insomnia because it was the cause. But then there are also people, as that it becomes a habit, really, doesn't it? Your body starts waking up because it's always woken up, and they really do need that help. And this is when we do give, the links in the UK to 3 different programs, which I will put in the comments, when I can get to them after this, of where you can try, because you can get it on the NHS as well in the UK.
And one last thing for Dr. Silverman, can you maybe share about how somebody would find a CBTI professional in their state, or especially in America? But I think there are other groups in Europe too, but
There are. So the best places to search for either a clinical psychologist or typically it's a mental health provider who also specializes in behavioral sleep medicine. One would be the Society for Behavioral Sleep Medicine. They actually have a directory where you can search based on location. So in the US, there's a map of the US. You can pick your state and you'll see folks who are trained in behavioral sleep medicine. There's also an international part of that too. So you can kind of search based on your country. So that's a really amazing resource. You might have to, depending on where you live, actually reach out to folks and inquire about whether they actually do provide CBT for CPAP use. So that is a little bit of an extra step, but there's definitely quite a few folks to reach out to, depending on where you live. And then there's also the University of Pennsylvania CBTI directory that also has a international directory. You can pick your country, you can pick your state, and you'll be able to find folks who are trained in behavioral sleep medicine who may be able to offer CBT for insomnia as well as CBT for CPAP use.
that's great. Thank you. Okay, so well, thank you so much, Dr. Silverman, and also Kath and Natalie from Hope to Sleep. I really appreciate all of your insights. I knew that an hour wasn't really going to be
No, it
long.
wasn't enough. We need double.
We need 3 hours, really. But hopefully we can put together, like with our toolkit that we're working on, we can add some more. Because I think we got to almost all the questions. Oh, so really quick, Felix was asking, do CPAPs not have a built-in humidifier? I'm newly diagnosed and haven't started CPAP yet. So the answer really is yes. Now almost every model you see has a built-in humidifier. What do you think, Kath?
Well, I was going to say the actual ones that are truly built in is like that would be the Fisher and Paykel sleep style.
Yeah, and the Dream Station 2.
Yeah. At the moment, you have to buy the Dream Station 2 with a humidifier, but every machine has a humidifier, but they don't all come with them as standard. So you would need to look, for one.
Yeah, I definitely recommend that you do that.
I would 100%. Yeah.
Difference. And then really quickly, oh, this is actually a good question. So Teresa is asking, what is the ideal pressure if mine is always at the max of my range? I think she means APAP range, of the prescription. Should the pressure range be increased? So that's definitely a conversation with your doctor. They get all of the data from your machine. So next time you go and see them and say, do you think this looks right? Or any concerns you have about pressure, that's a prescription. That's not a comfort thing. That's like, go and see your doctor.
But I would say if that's happening, and most people do have apps, if it's happening and your HI is shooting up above 5, that definitely wants a chat with your doctor, because
For
it
sure.
it could be a sign, yeah, that it needs upping.
Kath and Natalie, thank you so much.
Thank you. It's been lovely seeing you again.
You too. Okay, I'm going to share my screen and just do a little roundup here. Can everyone see my screen okay? So
Yeah.
this is my husband from my Instagram. This is just him showing how frustrating things can be. So this is some of the things that we talked about today. I think one of the things we didn't get to was hose problems. But we'll be sure to maybe like talk about that a little bit in the comments underneath the video for anyone that's dealing with that. And hair breakage, I don't think we've specifically mentioned it, but we certainly talked about headgear that can help with that. And so, yeah, there's a bunch that we didn't get to, but we will add it into the toolkit that we're building. So I just put a few resources here, but I know that Kath mentioned there's a bunch more links that we can share from the Hope to Sleep website. But I do really just want to shout out their Facebook group. Even though it's in the UK, the Hope to Sleep support group on Facebook is the really the best one, just because it's so, I'm not just saying that because Cass here, but in terms of like the amount of doctors that are involved with it, they have it really well moderated and it's really, really supportive and friendly. So even if you're outside of the UK, that's a really great Facebook group to engage with. So we'll make sure and share the link to that.
And most importantly, no judgment for anyone who feels a failure. We're there to help and support you.
Absolutely. Yeah. So yeah, and then I just kind of listed Project Sleep is not the only nonprofit working in the sleep apnea space in the US. So there's also the Alliance of Sleep Apnea Partners and the American Sleep Apnea Association and the Reggie White Foundation. So for particularly anything to do with if you can't afford to get your CPAP, like you get prescribed it, but you're not able for whatever reason to fill the prescription. The American Sleep Apnea Association and the Reggie White Foundation both work to get people the CPAP equipment that they need. Um, and then also, I did list a whole bunch of international organizations. So this is Kath and Natalie's Hope to Sleep right here. And so sometimes it can be really helpful to connect with people in your own country. And then just to kind of give a shout out that we do have a national sleep helpline here in the United States, which can help with navigating through, which kind of doctor you need to go and see. Just anyone with any sleep issues can call this. So yeah, I just wanted to shout that out. And then also we have a program called Rising Voices where we train people living with sleep disorders to share their stories and become patient advocates, sharing about their own experiences in their community. So I did this program and it runs for 6 weeks over the summer. Part-time, you do it remotely on Zoom. And I can't recommend it enough. Like since I did this program, I've spoken at so many different places. It just really helps you to hone your own experience and share good information with people. So the next training will be in the summer, and I believe it opens up next week. So you can go ahead and make sure you're following Project Sleep on socials or check out the website, project-sleep.com. And also, our work here wouldn't be possible without individual donors like the people watching, and also our corporate sponsors, Lilly and ApneaMed. And the biggest thank you is to everybody tuning in or watching the replay. We really appreciate you being part of our community. So the toolkit, the PDF toolkit I talked about during the session will be coming after the session. And so if you want to get that direct to your email inbox, you can sign up for e-updates. I think we have the link already below the video on YouTube. Also use the hashtag Sleep Apnea Squad if you want to share about your own experiences living with sleep apnea. on any of the social media that we're on. And then the big exciting news is mark your calendars for Sleep Apnea Education Week between the 18th and the 26th of April this year. So the Alliance of Sleep Apnea Partners here in the United States started this awareness week last year. And so this year we'll be participating in it, and we'll be launching a awareness campaign you can get involved with during that week. And that week also will be the next YouTube live like this one. Well, we talked a little bit at the end about shame and stigma around sleep apnea. So our topic will be fighting sleep apnea, shame and stigma. And I'll have some guests talking all about that. So hopefully we can build community and feel less alone. So that's all I have for you today. And I really appreciate you tuning in, and we'll see you next time.
Thank you, Emma, for all you do as well.
Thanks,
Yeah.
Kath.